Hello, my name is Michaela Ramm. I'm the healthcare reporter for the Gazette. COVID-19 cases across the state have been reaching alarming numbers in recent weeks, driving record-breaking numbers of patients into Iowa's hospitals and leaving local public health officials concerned about the crisis that Iowa may be facing heading into the holiday season. The surge in new cases has also really presented a major challenge for local contact tracers who are tasked with identifying and notifying close contacts of individuals who have a confirmed COVID-19 infection. And we're going to talk about that a little bit today. And with me is Jill, a contact tracer with Linn County Public Health. Thanks for talking with me today, Jill.
Sure, my pleasure.
Perfect. So Jill, how long have you been a contact tracer with Linn County?
I actually started shortly after the pandemic started, so March or April, I guess March, I think. So.
Okay. And what has this experience been like for you, particularly as we head into this new era of surging cases every day? What has this been like to be a contact tracer in this era?
Yeah, it's very interesting to talk to people who are positive with COVID. They have a lot of different emotions that they're experiencing at the time when we contact them, and lots of questions. And it's just been very fascinating. I think I get a different perspective about COVID from talking to people who have it than other people who are, in the community. So it's very interesting.
Yeah, definitely. And every day Iowa gets 4,000, 3,000 new cases a day, and a lot of them are obviously in the eastern part of the state too. So has that been a challenge keeping up and trying to do all that contact tracing for all of those cases a day?
It absolutely is challenging. I work part-time, usually evenings and weekends now that my job has started back up, but I see how hard that the public health department is working, Linn County Public Health, and every public health department, I'm sure. And it makes me very concerned because, it's every day, all day, it's every weekend, et cetera. And I just think that people are getting burnt out. It's a lot of effort and sustained energy level is required, and I'm concerned about the effect it's having on public health officials. So
yeah, absolutely. And at the same time, you're sort of running into, my understanding is, apathy from the people you're calling, or they're not really willing to always give you the details that you need, right?
Yeah, I've had fairly good luck with having people be willing to be interviewed and to provide the information. But, during the election cycle, when people were getting tons of phone calls and text messages, et cetera, sometimes it was hard to get a hold of people and they weren't willing to talk to us, et cetera. But I know that there are some contact tracers that have had some really difficult experiences. So.
Yeah, which is unfortunate, definitely. So I guess just for, our viewers' perspective, so they kind of have an understanding of what your job is, can you tell us, what is contact tracing and what steps do you go through when you get that case on your desk?
Sure. Okay. So COVID is a reportable disease. And so the Linn County Public Health Department receives all information about people in Linn County who have tested positive. And then we are to reach out to them to try and gather information. So we try a phone call. And if we can't reach them by phone call, then we send a text message and ask them to call us back. When we do reach somebody, we basically are just trying to collect information. When you look at the dashboards that the county or the state provide, there are lots of demographic pieces of information that they provide. So one of the things we do is to verify the demographic information, and then we talk about symptoms that the patient might have had. We talk about their work or school, so that we can kind of identify, whether they had worked or been at school within the 48 hours prior to their symptom onset, because that's an infectious period they wouldn't have known about. And most people have been at work or school during that time. And then we talk about travel, other contacts they might have had. And then at the end of the call, we talk about isolation and quarantine. So the individuals to go and is asked to isolate from other people, and any of the contacts are asked to quarantine. So we kind of go through that and then ask them if they have any questions. So.
Okay, absolutely. Could you walk us through some of those isolation and quarantine protocols? I know Linn County Public Health just announced that they're following CDC guidance now. Could you walk us through what that is?
Yeah, so that's one thing that I've really learned in this process is that it's very complex. It's not as simple as it initially sounds to people, because it depends on if a contact is a household contact or if they are a work contact or community contact. But and so, a lot of people need to have some guidance on that. It also is different whether they were symptomatic, because the 10 days of isolation counts with the first day of symptoms. If they're asymptomatic, then the 10 days starts from the day that you're tested. The quarantine period also varies. Everyone talks about 2 weeks of quarantine, but if you're a household member, it's actually a 2-week quarantine after last contact. So if you're not able to separate from your other family members, then your 2-week period of time begins on the 10th day when the person is considered recovered. So it's just a lot of complexity to it. So.
Yeah, definitely. And your role in that is to try to offer guidance and try to offer clear answers like, okay, this is when you isolate, this is when you start quarantining. Do you get a lot of confusion from the people you're calling and a lot of those questions?
Well, thankfully, at this point in the pandemic, people seem to be kind of aware. A lot of people have seen other people go through this at work or at school or in their family or whatever. So it's a little easier than it was earlier in the process here. So.
Good. Okay. So, I wonder about those people who may think they were exposed or worried that they were exposed to a positive case. What should they do in that situation? Should they call you? Should they wait for you to call them? What's the best way that they can find out their risk factors?
So if they've had a known contact with somebody who has had COVID and they feel that they meet the criteria of a close contact, then, we don't force anybody to test, but we do ask for them to self-quarantine, and to monitor for symptoms. And then if they have any questions at all, they should contact a healthcare provider. Sometimes that's the regular healthcare provider. Sometimes it's calling one of the other clinics in town. Sometimes it's going to Test Iowa, doing that survey online, and then getting tested. So we don't require anybody to get tested, but we do ask that anybody who thinks that they have been exposed or have any symptoms of COVID stay home, because we know that that's part of the problem, is that people are not isolating long enough and they are not quarantining long enough. And so that's how this virus spreads and gets out of control.
Right. And makes your job so much harder too, because then there are more contacts for you to try to reach out to.
And not just my job, mostly it impacts other people like hospitals and clinics, et cetera. So so that's the concern that I have, is that we might overburden the healthcare system. So.
Yeah, absolutely. So at a time like this, what would you like to see from the public? What would your wish be for them at this point in time to try to keep themselves safe and try to keep us from overwhelming the hospitals?
Yeah, I really think it's important to follow the recommendations that everybody has heard for months and months, and that is to wear a mask and to sanitize your hands and to try and keep a distance from other people. Try to limit your going places, not congregating with large groups of people, et cetera. And I think, a lot of people feel like it's not going to affect them or they're going to be fine or whatever. But I think if they could see the effects that it has on families and workplaces and schools to have multiple people out, I think that there would be a little bit more understanding of why these things are important. So it's not really about us and what we think might happen to us. It's really about the greater good for other people as well. So.
Yeah. Well, great. Well, thank you, Jill, for your time and talking with us. Jill Asprey with Linn County Public Health.
Thank you.